So the lecture content today will be focusing on different classifications of dyslexia as well as different classifications of dysgraphia. So I would like to begin discussing the basics of dyslexia. Dyslexia is the most common language disorder in the world with a prevalence rate of around 3 to 7%. Dyslexia is characterized by the lack of comprehension, spelling, writing, and sometimes reading out loud. There are several different classifications of dyslexia. These would include surface dyslexia, phonological dyslexia, direct dyslexia, and developmental dyslexia. Each of these classifications is paired with specific impairments critical to learning in everyday life. The first classification of dyslexia I will be discussing is surface dyslexia. A patient with surface dyslexia has trouble using the whole word method. In other words, the person does have a working lexical pathway consisting of memorized word pronunciations and spelling. A patient with surface dyslexia would have trouble with words that do not follow traditional pronunciation rules. A patient with surface dyslexia tends to rely on pronunciation rules to form their words, instead of their lexical pathway. Deficits displayed in surface dyslexia can be partly explained by the dual route theory. This theory proposes that there are two important pathways which consist of the lexical pathway and the non-lexical pathway. The lexical pathway is described as a working memory of words a person has collected throughout their lifetime. This pathway is extremely important and involved in language. The non-lexical pathway is more of a rulebook and protocol to the formation and pronunciation of words. So a patient experiencing surface dyslexia lacks a correct lexical pathway. However, they do still maintain their non-lexical pathway. This allows them to pronounce a word that follows their traditional pronunciation rules. If they are given a word that does not follow pronunciation rules, they will tend to struggle. The next form of dyslexia I will be discussing is phonological dyslexia. Phonological dyslexia is commonly caused by a brain injury or brain trauma. Phonological dyslexia can be distinguished from surface dyslexia because a patient with phonological dyslexia maintains the lexical pathway, but not the non-lexical pathway. A patient experiencing phonological dyslexia would be able to retrieve the pronunciation of familiar words correctly with the use of an intact lexical pathway. However, they would struggle with the pronunciation of new words or non-words. If the patient suffers a brain injury or a stroke, they would still have the ability to access pronunciation of words learned before the brain trauma. They would struggle, however, with learning the pronunciation of new words. The next classification of dyslexia I would like to discuss is called direct dyslexia. This form of dyslexia can also occur from brain trauma. Direct dyslexia allows the person to consistently read out loud. However, the patient would have trouble understanding and comprehending what they are saying. This can lead to many linguistic effects. The final classification of dyslexia I will be covering is developmental dyslexia. Developmental dyslexia is often apparent in childhood but can last throughout adulthood. Simple signs of dyslexia may include errors in speech and lack of phonological awareness. A person's phonological awareness consists of the connection and understanding of the pronunciation of words. Patients experiencing developmental dyslexia would have deficits in both spelling and pronunciation. So now I would like to move on to dysgraphia. In contrast to dyslexia, dysgraphia typically is concerned with the person's ability to write successfully. A patient experiencing dysgraphia would have trouble with transcribing their thoughts and writing in general. The two important classifications of dysgraphia include phonological dysgraphia and orthographic dysgraphia. Both of these classifications can cause impairments in a person's writing ability. So first, I would like to discuss both phonological and orthological dysgraphia. A patient experiencing phonological dysgraphia would struggle in their ability to write both unfamiliar words and words that are phonologically abnormal. A person with phonological dysgraphia would experience some spelling and writing errors. On the other hand, orthographic dysgraphia is described as deficits in a person's orthographic coding ability. Orthographic coding is a person's ability to store word pronunciation and spelling in their working memory for future use. A person experiencing orthographic dysgraphia would struggle with orthographic coding and memorization of word pronunciations. So this here is my supplemental source, and it is research done on individuals with brain tumors. So I decided to utilize this article discussing phonological and surface dyslexia. This study lasted over 4 months and included 33 individuals with brain tumors. The research hoped to expand on the knowledge of the relation of neuroanatomy to phonological and surface dyslexia. These individuals were tested for reading impairments during pre-surgery, intra-surgery, post-surgery, and follow-up. This research is significant because it aims to locate and confirm specific areas of the trauma related to phonological and surface dyslexia. So in their study, they found that around 7 individuals pre-surgery showed reading impairments, and around 18 individuals showed deficits intra-surgery, and around 26 individuals showed deficits post-surgery, and only 5 deficits were found during the follow-up. So dyslexia as well as dysgraphia can cause many different forms of deficits involving writing, reading, and speaking. Dyslexia tends to be more focused on deficits related to pronunciation or comprehension of words, and dysgraphia tends to be more focused on a person's writing impairments. Both dyslexia and dysgraphia can be heavily influenced by future research. The more complete of an understanding we have on these disorders, the better we will be able to treat our patients in the future. And here is my reference page.